Welcome back. My name is Jemima Beekers from the Namibian Sun newspaper. We are back here at the Communication Center, COVID Communication Center at the Commerce Regional Council. This afternoon we have on the panel the Health Minister, Dr. Kalumbi Shangula. We have also the Information Minister, Mr. Pea Mushalenga. Please stay tuned.
City of Windhoek. City of Windhoek in the past years, was regarded as one of the cleanest city in Africa. But we lost that status. Why? It might be because we, the responsible people in the office, were not taking care or serious attention towards the cleanness of our places in terms of, like, for example, open market. Now, when we are talking about COVID-19, we do not only want to talk hygiene just because of COVID-19. We want to talk hygiene for the next years and years to come. And we want to educate ourselves, the vendors and the customers. When they are visiting the open market, they have to ensure that the place is clean. Yes?
At the Commerce Regional Council. My name is Emma Theophilus and I'm here with Ms. Selma Moses, our sign language interpreter, to give you an update on cabinet decisions since the beginning of the state of emergency and the lockdown across the country. As you're well aware, listeners and viewers at home, that government has been working around the clock to ensure that we fight this pandemic in our country that stands at 16 cases. 8 of which have already been recovered and 8 that are still active. Every sector has been at work to ensure that the effects and impact of COVID-19 does not cripple our way of life and especially our economy. And that is why cabinet ministers and many government officials have been working around the clock to ensure that we're able to mitigate the impact of COVID-19. This afternoon, we're now joined by the Honorable Pea Mushalenga, who is the Minister in the Ministry of ICT, and Dr. Kalumbi Shangula, who is the Minister in the Ministry of Home Health and Social Services, to talk about what cabinet decisions have been made since, of course, the state of emergency, as well as the lockdown in the Commerce and Irongo regions, to which it was extended to the whole of the country, and what adverse effects these decisions will have in the way we are going to govern our affairs as we fight the pandemic. I therefore now call Honorable Dr. Pea Mushalenga, who is the official government spokesperson, to come give you an update on some of these decisions. Doctor.
Thank you very much, Deputy Minister, members of the media. I stand here to communicate to you decision taken by Cabinet at its meeting held on the 27th of April 2000. So, Cabinet took note on the implementation of the first phase of the economic and relief package. It took note that in the emergency budget for the Ministry of Health and Social Services has been reassessed to 727 million Namibia dollars. And the Ministry of Health and Social Services has been disbursing as part of the scaled-up continuation authorization. With regard to the emergency income grant, a total of 801,000 applications have been received to date, including repeat and non-eligible ones. Of these, 346,135 applications were paid an amount of 260 million Namibia dollars, and 40,788 applications are currently being processed for payment for an amount of 30.6 million Namibia dollars. Data analysis for potentially duplicate applications are 169, while 185 are multiple or group applications. 134 applications have been rejected. Payment to suppliers since the 25th of April 2020 totals to 2.5 billion Namibia dollars and have been utilized to settle invoices for COVID-19 related supplies. And in addition, a total of 1.3 billion has been used to settle outstanding VAT refunds. With regard to the stimulus package, Cabinet approved the Social Security Commission contribution to the stimulus and relief package of 250 million to relieve non-distressed sectors such as construction, tourism, farming, transport, entertainment, domestic workers, manufacturing, retail, and hospitality, which are negatively affected by the COVID-19 breakdown, and to avoid further retrenchments for a period of 3 months, that is April, May, and June 2020. Cabinet directed Ministries of Finance and Labor, Industrial Relations and Employment Creation to finalize the modalities for implementation and the rollout of the wage bill subsidy. The subsidy is co-funded by the government and the Social Security Commission, with the government funding it to the tune of 400 million Namibia dollars and Social Security Commission contributing 250 million Namibia dollars. With regard to agriculture business loan scheme, Cabinet approved in principle the proposed relief and stimulus measures by Agribank to assist agribusiness and individual farmers affected by COVID-19. The proposed relief and stimulus measures provides installment relief for up to 12 months, interest rate relief, ITC delisting, and pending legal or pre-legal actions, as well as extending new stimulus loans to enable farmers to diversify their income streams. Cabinet directed the Ministry of Finance and Agribank to expedite the modalities to facilitate the implementation of the relief and stimulus measures. SMEs Assistance Loan Scheme. Cabinet noted that the scheme aims to provide new loans to non-agricultural small business and to absorb the extension of limited loan repayment holidays of 3 months for qualifying customers. Cabinet directed the Ministry of Finance and the Development Bank of Namibia to expedite the finalization of the SMEs Assistance Loan Scheme modalities for Cabinet's consideration and approval. Directives relating to reopening of open markets. Cabinet took note that the directives on reopening of open market during the state of emergency have been finalized and gazetted for implementation. And Cabinet directed the Ministries of Health and Social Services and of Urban and Rural Development to continuously monitor compliance to regulations in the open market to ensure compliance to COVID-19 state of emergency regulations. And Cabinet directed that open markets should be reopened subject to certification by the Ministry of Health and Social Services and of Urban and Rural Development. Distribution of COVID-19 food rations. Cabinet took note and approved the COVID-19 food rations measures as follows. All donations should be channeled through the Directorate Disaster Risk Management in the Office of the Prime Minister for central coordination, where a register of all donations will be kept. The Directorate Disaster Risk Management should channel the items to communities with identified needs or where donors directly coordinate with government structures at national or regional level for the distribution of the donations. This is in line with the proposed standard operating procedures awaiting the approval of the Attorney General. The regional governors and regional councils should ensure that the beneficiaries are identified and endorsed within the regional disaster risk management committees. The distribution of all food items to communities should be channeled through respective regional councils for ease of coordination and to avoid duplications. The regional governors and regional councils should hold technical officials accountable for distribution of food ratios as per the agreed list, and that political parties should be requested to advise their party representatives to abide by the set arrangements. Beneficiaries of other relief programs, including emergency income grant, should not benefit from the COVID-19 food assistance, since they have already benefited from the income, from the emergency income grant. Cabinet directed that the distribution of food should be centralized and coordinated through the offices of the regional governors. And the Cabinet directed the Ministries of Urban and Rural Development, and of Agriculture, Water and Land Reforms to develop a post-COVID-19 strategy for homeless persons. With regard to the deliverables during the COVID-19 state of emergency from the Ministry of Health, Cabinet noted that to date, 1,053 staff members have been recruited, and that 10 ventilators have been delivered and installed in Windhoek, Onanjokwe, Shakati, Swakopmund, and Keetmans. It is expected that during the state of emergency, 1,400 persons will be tested. And that 12-bed isolation facilities at Windhoek Central Hospital, the construction of this facility has been completed and is ready. Cabinet also endorsed the Joint Security Ministry cluster budget amounting to 109 million Namibia dollars to carry out their mandate during the state of emergency. That is the Ministry of Defense and Veterans Affairs, Home Affairs, Immigration, Safety and Security. High-level research coordination task force on COVID-19. Cabinet approved in principle the high-level research coordination task force on COVID-19 budget amounting to 5.5 million to be defrayed from the National Commission on Research, Science and Technology. And Cabinet directed the Ministry of Higher Education, Training and Innovation to finalize its academic calendar year in consultation with the Ministry of Education, Arts and Culture and other stakeholders for Cabinet's consideration and endorsement. Cabinet directed the Ministry of Higher Education, Training and Innovation to engage the National Planning Commission for sourcing of additional funding for the research project. And finally, Cabinet directed that all directives in respect to state of emergency regulations should be issued by the offices or ministries or agencies in consultation with the Office of the Attorney General as provided in the regulations. I thank you very much.
Thank you very much, Honorable Minister, for that update on Cabinet decisions taken in the time of the state of emergency during this time. I would now would like to get into the conversation around a health update and also what some of these decisions mean for the Ministry of Health in ensuring that we curb the further spread of COVID-19. Honorable Shangula, what update do you have for us this afternoon, and what does this boost in the finances of the Ministry of Health mean in the fight against COVID-19 in Namibia?
Thank you very much, Honorable Minister of Information and Communication Technology, Honorable Deputy Minister. Ladies and gentlemen, good afternoon. The update for today was given already this morning at this center, and I can just inform you that there has been no changes in the update with regards to new development in the health sector as far as COVID-19 is concerned. So the status quo remains as per briefing which was given this morning by the Deputy Minister of Health and Social Services. The fight against COVID-19 continue, and as you have heard from the cabinet briefing, it is not only involving the Ministry of Health and Social Services. The situation as it is with the state of emergency, with the current lockdown, has got wider ramifications, and as we have heard from the briefing, many sectors are involved and many activities are ongoing. All of them are aimed at mitigating the impact of COVID-19 on the Namibian people. So this state of affairs will continue until we eventually have overcome the situation as presented by this world pandemic.
Thank you very much, Doctor. I also would like to inform our viewers and listeners at home that we're not taking any call-ins this afternoon. Should you have any questions or queries about the announcements made about cabinet decisions at the briefing made here, please do not hesitate to email us at covid.nam@mict.gov.na for your questions and queries to be addressed when we get the chance. I'd now like to invite media practitioners in the room to then pose any questions they might have to the Minister of ICT and the Minister of Health with regards to the update this afternoon or any other questions they might have.
Good afternoon, Charmaine from the Namibian newspaper. I want to know, has Cabinet maybe decided on extending the lockdown or whether we're going to lift it, because it's next week that it will come to an end? And then maybe, do you have any information on the second phase of the stimulus package? Thank you.
Thank you very much, Charlene. Yes, Honorable Minister.
Thank you very much. That information that you have asked for is not yet available because there will still be a cabinet meeting that will be sitting tomorrow, and after that, His Excellency the President is going to make an announcement on the way forward after tomorrow's cabinet.
Thank you. Are there any other questions?
Good afternoon, Ministers, Minister Mshelenga and Dr. Shangula, as well as the Deputy Minister. We just this afternoon received a statement from the Namibia Employers Federation, not being happy with the Proclamation 28. I'm not sure if I have it correct, but it was published on the 28th of April and basically saying that retrenchment should be avoided. Now, what the statement says in short is that they are basically not happy with it and they are even threatening litigation if status quo continue. Minister Mushelenga, what is your response to this?
Well, government has obligation and responsibility towards all parties, both employers and employees. That's why you have that proclamation. But that proclamation is just not in vacuum. It's because government is also stepping in to assist employers in paying their employees during this time that they have not been productive and that they have not been making any profit whatsoever.
Thank you, Honorable. Yes, ma'am.
Jemima Bekus, Namibian Sun newspaper. This is to Honorable Peya. We have seen over the last few days the city of Windhoek demolishing some people's shacks. Now, this is an extraordinary time, and obviously one would expect the police at least to handle this thing differently, especially if it is illegal settlers. What is government's position on the demolitions continuing during this time? Thank you.
Thank you.
Thank you very much. This is a state of emergency, and during the state of emergency, the situation is treated differently, that it is not as normal. Ideally, everyone should have a roof above their heads. That's why you see that even those people that do not have shelter, government is trying to provide shelter for them.
All right. Do we have any other questions? Okay, since we have none from the floor, just from me, in general, Honorable Ministers, perhaps, just to give us an overview, Honorable Mushelenga, you gave a lot of statistics, of course, about the money that has gone into, for example, the income grant to those that have applied for it, 2.5 billion paid to support related supplies of COVID-19, as well as the wage bill subsidy that is to be rolled out to the tune of 400 million. All of these, of course, are government's interventions to try to get everyone to cope in this situation. At this point, when we then look at if we're going to have post-COVID-19 situation, what does this mean that for everyone that has, of course, benefited from some of these interventions that have been put in place, what responsibility are we expecting from our citizens moving forward to bring things back to normality in order for us to then get back into the tune of making the economy become more productive again?
First, it is expected that those that benefited financially are supposed to act responsibly for the interventions that they received, be it individuals or institutions. If indeed institutions have received intervention, then they are supposed to keep their employees so that when we are out, they are able to continue with production. Because when you retrench your employees, by the time we come out of this situation, you have to start afresh, and it will not kickstart of the economy very fast. And for the individuals that have benefited, again, they appeal to and encouraged to use those interventions prudently and not irresponsibly.
Thank you. Honorable Shangula, we have had sentiments about our healthcare system before COVID-19 and now post-COVID-19. What is the outlook on our healthcare system? What are the lessons learned? What are we looking towards to obviously keeping as some of the lessons learned to better improve our healthcare system in the country?
Yes, the health sector, the public health sector is one of the sectors which government support heavily. And if we look at the consecutive annual budgets, the Ministry of Health and Social Services received quite a significant amount of money to improve the health service of the Namibian people. And of course, one has to understand that more than 85% of the Namibian population, they depend on the public health sector. But it is also a sector which is resource intensive in terms of its maintenance. Now, if we look at the particular service, it requires up-to-date technology. It requires highly trained personnel in different fields. It's a very, so to say, heterogeneous combination of people from different backgrounds, whether it's medical, pharmacy, dentistry, nursing, you can mention allied profession. They all work together to complement one another to ensure that the service which is provided to the public is of quality. Of course, it requires also infrastructure, and it also needs expansion. The population of Namibia increases. At independence, it was about 1.2 million. Today, it's about 2.5 million. So the number of people in Namibia increases every year, and at the same time the needs are also increasing, and therefore the services and the infrastructure has to keep up with the increased trend of the population in order to catch up. We had our share of challenges, which has got a number of factors. Some are from within, some are from without, but over the years we have been able to overcome that. The experience of COVID-19 has also presented us with an opportunity to see exactly where we did not have all the necessary equipment in place and all the necessary human resource in place. And it has been explained that we have recruited more than 1,000 additional personnel in order to be able to cope. I also need to emphasize the fact that even during COVID-19, the usual health conditions which has been there all along with us, they still remain. So on top of those, we now have the imperative of COVID-19, which will mean that although we are focusing mostly on COVID-19 currently, we should not forget our primary mandate, that's to ensure the health of the Namibian populations. Malaria is still continuing, and now we are in the malaria season. The number of cases are increasing. We still are battling with hepatitis E, but in all those fronts, we do not want to say that we do not allow ourselves that since there is COVID, we should forget about other conditions. So all this one, we are taking them, simultaneously. Yeah.
Honorable Minister, just to that then, you're saying that the ministry is doing a balancing act in managing COVID-19 and other existing problems or issues around the public health sector that have been there. We have had 8 recoveries and 0 deaths. What has been the experience there? This is something commendable. So what does that say about our public health system currently?
Yes, I would say that we had an opportunity to put in place the necessary measures to combat COVID-19. As you may remember that WHO declared the outbreak of COVID-19 already in December, on the 31st of December 2019. And by the nature of the disease itself, we are conscious of the fact that eventually it will land on our doorstep. And therefore, we had an ample opportunity to prepare ourselves for COVID-19. And when we got the first case on the 13th of March 2020, we are sort of already prepared, and immediately we took the necessary step The first one was containment, to contain and to isolate and to give public education, because the success of a pandemic of this nature, it really lies if the community, if the public is aware of the disease and they are cooperating. So far, we must say that to a various degree of the cooperation of the public, which also enable us to achieve these results. Yes, to a large extent, we have managed to prevent widespread community transmission. That has remained the key factor in containing the disease, plus other measures which we have put in place, training of the staff, being able to know how to manage cases, and also to ensure that all the contacts are brought into the fold so that no further transmission can take place. Yes, we are happy with the success we have scored so far, but as I always said, that the job is not yet done. We have no reason to be complacent, because a disease of this nature can anytime surprises you. As we have seen in previous epidemics, although there might be a lack of, the number of cases may subside, but the possibility of a second wave can also not be excluded from the pattern of the disease, which spread in the same way as the COVID-19.
Thank you, Honorable Minister. We have another question. Yes, sir.
Yeah, thank you very much. Dr. Mushilenga, the occurrence and spread of false news, fake news, disinformation continue unabated. Yesterday we learned that falsely that 22 October the lockdown will be extended. Today we also learned that 300 people, and that's again false, will have been found to be corona positive. What are your views on this issue, despite the fact that now fake news have been criminalized? The other matter is, did Cabinet not assess the current situation, and did they not make a pronouncement in this regard? And did I hear correctly that an announcement would be made tomorrow? Thank you.
Thank you very much. Yes, you just said that I've indicated that Cabinet is yet to sit in order to look at the way forward. And once Cabinet take a decision, His Excellency the President is going to make an announcement. That's one. Two, with regard to ongoing misinformation and disinformation, I can only repeat that there remain only one Minister of Health in the Republic of Namibia who is authorized to provide information related to the COVID-19 pandemic. There remain only one government spokesperson, Minister of Information and Communication Technology, who is to convey what Cabinet has decided. And there remain only one Chairman of Cabinet, that is His Excellency the President, who at times also provide information on major decisions taken by the government with regard to the COVID-19 pandemic. All other sources are not authentic, and they should be treated as such, not authentic, and do not serve any progressive purpose. Thank you.
Thank you. There's
May
a question.
I
Yes.
May I just add to what the Honorable Minister have said with regards to fake news, that they are now, any fake news is now criminalized. So anybody who either create or disseminate fake news as far as COVID-19 is concerned, with the aim to cause panic or despondency among the population, can be successfully prosecuted. So people should understand this, and they should know this, so that when the law catch up with them, they should not be surprised. It's a criminal offense now.
Thank you, Honorable Minister. Yes, ma'am.
Yes, I have a question for Dr. Mushelenga. I would like to know, you said the health budget has been reassessed to 727 million. Is this now in addition to the 1.1 billion that was announced earlier in the first stimulus package, or is it a reduction and you've reduced it by roughly 300 million? And if it's a reduction, why has the budget been reduced? Thank you.
Thank you.
I think I'll pass over the question to the Minister of
Yes.
Health since it's...
Thank you very much. Maybe I allow you to sit down so that you... Okay. The overall budget of the Ministry of Health and Social Service for COVID is 1.1 billion. Now, 727 of that amount, this is the actual budget which has been committed. The remainder is the contingency. So altogether, it makes up 1.1 billion.
Thank you very much. One last one.
To add on to the 1.1 billion budget for the Ministry of Health, Honorable Minister of Health, the ministry has rented some, like the apartment that was rented for people to be quarantined in. Some of the other places were hotels or so, or lodges or so. How much has government spent on these private quarantine facilities? Thank you.
Yes, thank you very much for your question. If I understand it very well, you would like to know how much the government spent on the quarantine, for the quarantine.
On quarantine facilities, at lodges, at
Yeah.
hotels, and so on.
Yes. I do not have that figure now with me, but the figure is available. But, you know, the whole budget, it caters for many other things. It caters for the quarantine, it caters for the isolations, it caters for the medicine, for personal protective equipment, it caters for medical equipment, etc. So all the expenditures, all the necessity related to the response, they are all included in that figure which I have just cited out.
Thank you. As we wrap up, Honorable Ministers, perhaps just to gauge you in one question as you now give your concluding remarks, maybe we can start with you, Honorable Shangula, and the same question to Honorable Mushelenga is, there seems to be some doubt about government's interventions in which have actually shown results in handling COVID-19. Just as a word to rest some of these doubts, some of this mistrust, and perhaps people not gauging with what has actually been happening from the Ministry of Health side and government side to try to fight COVID-19. Just words of them to put some of these things to rest as to the interventions government has taken has actually put us at the point we are now, where we have 16 cases where we have 0 deaths, 8 active, 8 recovered, and the interventions being taken are so far keeping us above water. So perhaps just a word from both of you in conclusion as to government stance on this, and that people should find a way to trust government more.
Okay, let me start with that. I have stated on previous occasion that in dealing with COVID, we are as transparent as possible. The only exception is when we have to protect the privacy of our clients. That's our fundamental principle, which is universal. and which we continue to uphold. But whatever we have been doing, we have been transparent, we have been coming here, we have shared the information with the public, etc., etc. Now, as I mentioned, that a lot of activities are taking place behind the scene. Most of them you may not even be able to see. When we open, for example, the Emergency Operations Center, there are men and women who are manning that facility for 24 hours. In other words, they stay there anytime, every time, answering to the queries of the public. I remember there was one time here a question asked, how many calls are received per day? And I didn't have that figure, but I can confidently you that no less than 25,000 calls per day are recorded at that emergency operations center, where the public, they call in, they would like to get information, they're asking for assistance, and our response team, they then received this information from the call centers and then act accordingly to assist the public. So in our response team, we'd have different people from different backgrounds, especially also those who are responsible for psychosocial support. As you clearly understand, and what we have now observed is that there is a certain degree of stigma attached to COVID-19. Even our health workers have experienced that. I was told a story that some of the transport operator, whenever they see a nurse in a uniform, they wouldn't want to allow that person to get into the car because they just see COVID-19. But of course, that is a result of the ignorance, and our team, which is responsible for public awareness, have been hard at work to inform the public, to educate the public that there is no need to stigmatize anybody. The only thing you need to know is what is COVID-19? How does it present itself? How does it transmit from one person to another person? Once you have that fundamentals, then there is no need for you to be afraid, there is no need for you to panic, and there is no need for you to discriminate against any other person. And of course, we have our health workers who are working very hard day and night, really trying to put things in place. Not only in the hospitals, not only in the public, but also at the checkpoints. We have people who are there 24 hours together with men and women in uniform to ensure that at checkpoints things also go smooth. It's a combination of so many activities which actually have brought us to the stage that we have been in a position to contain the further spread of the disease. And I think this is one thing the Namibian people would be pleased to feel proud of, and to continue to render the support to those who are really at the forefront of the fight. And we should continue during this way until we finally overcome COVID-19 in Namibia so that things can come back to normal. We know that we are undergoing a period of difficulties, but it's the necessary sacrifice we have to make so that we eventually overcome the disease. Yeah.
Thank you, Honorable Minister. Honorable Dr. Mushelenga.
Yes. What I would want to assure the public is that government is hands-on as far as the COVID-19 pandemic is concerned. Ministers are sitting 4 times a day. We had a cabinet chaired by the president this Monday. That's why I was giving records of that meeting. We have economic ministers cluster meeting that meets twice in a week. It was meeting yesterday. And other clusters are also meeting. Today, the Minister of Health and I, as we came here, we are directly coming from the deliberative cabinet meeting. We left it in progress. And tomorrow we'll have a decision-making cabinet meeting. That tells you that no single day would pass without us attending to issues related to COVID-19. And these issues will not escape the eyes and the ears of the government. And a normal 5 days a week program, there's only one day in between, that is a Wednesday, when ministers go and attend to other issues. But every day they meet in order to ensure that we address this pandemic. That's why we have been successful as government in attending to the needs, and we require the cooperation of the public, because government alone, if we put in place policies and regulations but the public is not complying, we are not going to be successful. And it is required that the public must cooperate. It is not the first time that we have a plague of this nature. 100 in the year 1918, we had a Spanish flu. It also affected here, and people were complying and abiding already that time. So we should take example from them. Thank you.
Thank you very much, Honorable Ministers. Thank you to our viewers and listeners at home for always tuning in. I think you cannot hear it any better. The government of the Republic of Namibia is working day and night to ensure that we're able to overcome COVID-19, and with every citizen's cooperation in this country, we will be able to overcome it. So please continue to join us for our daily sessions at 10 in the morning, at 4 o'clock in the afternoon, to hear updates about anything COVID-19 related in Namibia, as well as sending your questions and queries to our email address, that is covid.nam@mict.gov.na, and of course the hotline number of the Ministry of Health around COVID-19 health issues, that is 0800 100 100. Please, if you have any queries and questions, do not hesitate to do so, to ask, because this communication center, as you know, it has been set up so that we avoid misinformation, disinformation, and fake news that continues to make the rounds on our WhatsApp groups, our Facebook groups, as well as any other platforms that we find ourselves on. Please be cautious, stay calm, continue following the regulations, and we're able to boot COVID-19 out of Namibia. Thank you for your time. Continue engaging, continue complying, and being responsible citizens. See you again. Thank you, Honorable.
Welcome back. We are still here at the COVID Community Center. A very strong call on Namibians to adhere to the regulations. Otherwise, we won't be able to return to normal. So stay safe. Thank you.